Hello and welcome to the Unit 1 lecture for Scope of Practice in the Nursing Profession. These are your learning objectives for this lesson. This is what you're expected to learn from this unit, from my lecture, and your text and other resources, so make sure you go through them and can answer each one in preparation for the test. So Florence Nightingale started nursing, basically. You can read about her in your text. But in this course, we'll build off of that. You'll be taught the foundations of nursing. Nursing has a specific body of knowledge which you'll learn in this ADN program. As you evolve as a nurse, you go from being a novice to an expert. You'll hear a lot about the use of critical thinking. As you evolve and learn in this program, you'll develop critical thinking skills. Critical thinking means you develop an intuitive sense of a situation and respond accordingly. As an example of critical thinking, you managed to come to class. That may have involved juggling work, family, schedules, driving here, bringing your backpack, your lunch, your water, all those things. You thought all of this through in your mind almost routinely without needing to look in a book for the answer. That's critical thinking, being able to think on the fly, not relying on looking in a book. The scope of practice describes the who, what, where, when, why, and how of nursing practice. Your scope of practice is dependent on your education, experience, and role. For example, I'm a certified critical care nurse, meaning I have special education and experience in critical care nursing. When working in critical care, I receive specialized training and education to perform that role. I'm not an OB nurse. I can take a blood pressure and do a physical assessment on a mom, but I am not specialized in the care and needs of that specific population. If I started working in an OB unit, I would need specialized training prior to caring for an OB patient. Those specialized skills are not in my scope of practice. As a graduate nurse, you will have the skills and tasks to function as a nurse in a general medical setting. You will learn about disease processes and focus on assessing and caring for the general medical population. Although you'll have clinical rotations in OB, mental health, long-term care, you will not graduate with a specialized scope of practice. Maslow's theory of hierarchy of needs is based on the notion that all humans are born with instinctive needs. The needs are arranged in order of importance from those essential for physical survival to those necessary to develop a person's fullest potential. Physiologic needs include air, nutrition, water, elimination, rest, sleep, and thermoregulation. Safety needs include shelter and freedom from harm or danger. Love and belonging needs include a need for affection, feelings of belongingness, and a meaningful relation with others. Esteem needs include the need to be well thought of by oneself and others. And self-actualization needs include the need to be self-fulfilled, learn, create, understand, and experience one's potential, to maximize one's potential. The person cannot move to a higher level of needs until the basic needs have been met. So how will you use this theory in your nursing practice? Nursing helps people meet needs they can't meet themselves. For example, physiologic needs and safety needs such as fall prevention, pressure ulcer prevention, all those things we help our patients to meet before we can move on to the next level. So holism is based on the belief that people can't be fully understood unless they're looked at as part of their environment rather than looked at in pieces apart from their environment. And this is important in nursing, and we look at the 3 domains of nursing which are listed here, which is health, illness, or absence of health. And we also look at the things that influence the health beliefs, such as their background, their cultural, that kind of thing. So to recap, nurses look at the whole picture of how illness is experienced by patients and families. Think about the illness duration, illness behaviors such as coping skills, and then the impact of illness on the family unit, or the impact of illness on the patient that doesn't have a family to fall back on. So what I want you to do is pause here, take a few minutes to apply what we've talked about to this scenario, and then we'll meet back and continue. So how does our healthcare system work? The Joint Commission examiners provide accreditation to the agency. Without accreditation, insurance carriers will not pay for services performed. And also, patients are broken down into DRGs, which are diagnosis-related groups, and payments are based on this as well. This affects how nurses take care of patients through things like patient acuity, how sick is the patient, how much workload is the patient, staff-patient ratios, prioritization of cares, teaching patients for discharge. There's a issue with patients that go home and don't have appropriate discharge care documented for certain diagnoses such as stroke or heart disease, heart attack. If that documentation is not there and the patient doesn't receive that education, whether you gave it or not, if you didn't document it, they didn't get it, and then they're admitted within so many days, Medicare may not pay for that second hospital stay. So it's directly impacts nursing practice in that regard. There's also a concern for no-pay events such as pressure ulcers, stage 3 and 4, COTI, which is catheter-associated urinary tract infection, and falls with injury. Hospitals may not get reimbursed for these either, which affects the funding that they have to pay for more nursing staff. The nurses work in primary, secondary, or tertiary care. Primary care are preventive care services such as screenings, immunizations, and health promotion activities. Secondary care often requires an elaborate diagnosis and treatment, and this is in an acute care setting, whether it's the emergency room or an inpatient unit or an intensive care unit. And tertiary care is rehabilitation type cares. And this is like long-term care, not talking about drug rehabilitation, but long-term type care. So think about this for a minute. Where are the most resources absorbed and where are the population's greatest needs? So interestingly, most resources, services, and nursing care and nursing education are in secondary care. However, the population's greatest needs are in primary and secondary care. So there's a little bit of a disconnect, a little bit of an imbalance there between what we're giving out and what patients' needs are. So take a minute here as well. You can pause this and just think about some settings that nurses work in, and then we can talk about that in class, but have a good understanding of different types of nursing. So different places that nurses work are hospital settings, nursing homes, assisted living, home health, hospice, clinic. They work in the military. There's parish nurses that work for churches, either paid or volunteered. School nurses, public health nurses, the list goes on and on. So for licensure, you must graduate from an accredited school of nursing and pass the NCLEX to become licensed by the State Board of Nursing in your state. And of course, an NCLEX is your licensure exam. The Board of Nursing can also suspend or revoke your license if you violate provisions of the licensing statute. And interstate compacts exist if you move to another state. Now they're not all the states aren't linked up, and sometimes you know, like a traveling nurse or somebody needs to be licensed in multiple states. But like sometimes 2 or 3 or 4 states come together and say, if your license is good in this state, it's good in these other 3 states also. So the moral of the student nurse story is be prepared, study, learn, and don't just memorize. Participate, ask questions if you're not sure. And what I would like to give you for this takeaway is that the know-it-all nurse is the scary nurse because they're too proud or too ashamed or too something to ask questions. And if you can't ask questions or don't want to ask questions, that's when patients suffer because you don't know what you don't know, and there's nothing wrong with asking for help. So, physician orders, nurses carry out orders that healthcare providers give. Now, whether it's a physician order or a nurse practitioner with prescriptive authority or a physician assistant, um, those are all types of providers that can give orders for nurses to carry out. So, what if you think the order's wrong? What do you do? You seek clarification from the provider. If they still want you to do it, but you feel it's inappropriate or could be harmful to the patient, do not carry out the order. Talk with your supervisor, talk with your charge nurse. You're legally responsible for any harm suffered by the patient, even if you're just doing what the provider said. I was just following orders is not a valid defense. And one story I wanted to tell about this was early on in my nursing career in the critical care. I was caring for a patient that had had a big surgery and did not do well, and they were going to withdraw life support on this patient. So the patient had a breathing tube, and the surgeon was not real comfortable with this because it doesn't honestly happen a lot of the times to surgical patients. But he was giving me the order to withdraw support, and he gave me an order, a verbal order that said to give a paralytic medication and to give 10 milligrams of morphine IV. So I looked at him and I said, I cannot do that. And he said, well, why not? And all I could think to say to him at that time was that, well, because that's murder and I can't do that. And I did say that to him, and we did have a good relationship at the time, but the point being, he was not coming at it from a take this person's life standpoint. He was honestly coming at it from a, I don't want this patient's family to see this patient suffer or struggle in any way, which, you know, is something that's a good thing not to have a family watch, but we cannot cross over that line and actively take a person's life away. So you just need to watch your orders, and you just don't be afraid to speak up if something doesn't seem right, because if I would have given those medications, I could have gotten arrested for murder if the family would have, you know, come forward with that. So we just really have to be careful. Providers are always trying to do what's in the best interest for the patient and the family, but sometimes what they're ordering doesn't jive with what really we should be doing. So HIPAA stands for Health Insurance Portability and Accountability Act. It's a law passed by Congress in 1996 to protect the privacy of patient records. It mandates that medical records are to be electronic and then can be easily transmitted. Sometimes not all records are going to be electronic, although it's getting to be more and more, but it was funding to advance the electronic medical record. It protects patient confidentiality, and this includes using patient identifiers that protect their privacy. So for an example, you would only use patient initials if you were calling somebody in a waiting room, or sometimes they just use the first name but not the first and last name. You don't want to discuss patient information in public settings, and only discuss information with those directly involved in patient care and with those who need to know or are authorized by the patient to know. And just keep in mind there's substantial financial penalties for breach of privacy, like tens of thousands of dollars. So confidentiality is a really big deal for patients. So the ANA is the American Nurses Association, and this is the premier organization representing the interests of the nation's 3.6 million registered nurses. The ANA advances the nursing profession by fostering high standards of nursing practice, promoting a safe and ethical work environment, bolstering the health and wellness of nurses, and advocating on healthcare issues that affects nurses and the public. The ANA is at the forefront of improving the quality of healthcare for all. The ANA also maintains the Code of Ethics for Nurses, which was first developed by the ANA in 1926. And that just gives us, as nurses, rules that govern the right conduct, what ought to be, or the right thing to do, and the should of human behavior. That encompasses ethics. The levels of nursing education are outlined here. remember here that the unlicensed assistive personnel works with the nurse. The nurse is responsible, though, for delegating appropriate tasks to the aide, and the nurse is also responsible for the work that the aide completes. So think about the aide who gets a set of vitals and documents them. The blood pressure might be very, very low. The aide didn't report it, but it's documented. So then who's responsible for that? The nurse. The nurse is responsible for gathering, assessing the data, even if they didn't actually take the blood pressure. And it doesn't matter if the information was reported to them by the aide or not, they're still responsible for looking at that information and acting on it. There's clear delineations for what an RN versus an LPN can do. Review these differences carefully. The RN can assess and analyze the data. They can teach and supervise staff. And then the LPN provides basic direct patient care, technical care. The LPNs can collect data, but they can't analyze it. So what this means is the RN's doing the assessing, the care planning, the LPN's doing the technical care. They cannot do the care planning. They can carry out interventions in the care plan, but they cannot form or modify the plan of care. And then after 2 completed semesters, you can sit for your LPN boards and then continue on from there if that's something that interests you. The state boards of nursing are authorized to develop administrative rules and regulations that are used to clarify or make the statutes more specific. Rules and regulations must be consistent with the Nurse Practice Act, cannot go beyond the law, and once enacted, do have the full force and effect of law. The Wisconsin State Board of Nursing provides a definition of nursing and the scope of practice for nurses from the LPN level to the nurse practitioner level. Nursing regulation is the governmental oversight provided for nursing practice in each state. Nursing is regulated because it's one of the health professions that pose a risk of harm to the public if practiced by someone who is not prepared or not competent. The public might not know or understand that they have an unqualified healthcare provider, and they're vulnerable to unsafe, and incompetent practitioners. So through regulatory processes, the government permits only individuals meeting a predetermined qualification to practice nursing. The Board of Nursing is an authorized state entity with the legal authority to regulate nursing. So legislatures enact the Nurse Practice Act for a state, and the Nurse Practice Act typically defines the authority of the Board of Nursing, its composition and powers, and defines nursing and the boundaries of scope of practice. It identifies types of licenses and titles. It sets the state's requirement for licensure. It protects titles, and it identifies the grounds for disciplinary action. So just be sure that you have a good understanding of these terms, and that is the end of this lecture, and we will see you next week in class.